Welcome to Close Up Radio, where our hosts Doug Llewellyn and Jim Masters engage today's top thinkers from around the world to bring you information, inspiration, and thought-provoking ideas you can put to use in your personal and professional life right now. Covering a broad range of topics, Close Up Radio digs deep to discover what makes today's top thinkers tick. Close Up Radio, where ideas matter. And now, here's today's host, Doug Llewellyn.
All right, well, thanks. Welcome back, folks. I'm Doug Llewellyn. Nice to have you with us today, and I'm really excited because we're going to welcome back Dr. Gourang Patel, who was a guest with me earlier last month. So it's been about 6 weeks since we've spoken. But he opened my eyes to a field in medicine that I wasn't aware of at all, and that's called the PharmD. It's a pharmacist who does more than normal Rexall drugstore than RX drugstore pharmacists would do. Let me fill you in a little bit, tell you about him and what a PharmD is. As you know, today's pharmacists have really evolved beyond the traditional transactional role of the drugstore pharmacist to become a crucial contributor to the clinical healthcare team. A PharmD works alongside the clinical team to look at a patient's medications, to provide consultation with the other doctors on how to adjust the drug dosage. PharmDs really observe healthcare in action in real time and learn from it, and they provide guidance on how to manage it rather than just issuing medications from a drugstore or the pharmacist. Forensic pharmacy is the intersection of the law and prescribed medication. This is a different aspect or an additional aspect of what PharmDs do. A forensic pharmacist can be a really valuable resource in legal cases involving medicines and medications, and they combine the science of pharmaceutical drug research with criminal justice and legal practice. A forensic pharmacist may be called upon to testify in a court case about the side effects of a drug or to perform research and determine the effect that a drug had in an individual's death. Now, our guest, Dr. Gourang Patel, is known as the PharmD expert. He is a clinical pharmacist in the intensive care unit and the perioperative area, as well as a consultant specializing in the areas of pharmacy, toxicology, and pharmacology. And he has served as an expert and a consultant in the areas of pharmacy, toxicology, and pharmacology from court cases, and he consults equally for the defense as well as the plaintiff. As he points out, very rarely are case reviews straightforward, but the vast majority share some common themes, integrating medication, patient medical history, and objective laboratory values like toxicology reports from a medical examiner. He says sometimes you will submit a review and it's not what they expected, but that's what the science reveals. Other times it confirms what they expected or suspected. Either way, it's a big help. And the foundation of this field is based on the principle of learning. So it's always evolving. It never stops. And if you wonder what are the ramifications of utilizing drug A versus B versus C in the same type of surgery, is there a safer alternative? Is there a more cost-effective alternative? How do all these medications interact with other medications? That's what a PharmD does and how he works. It's a much deeper dive past what's in a textbook. It's like taking a step further and saying, I'm observing clinically, or what I'm observing clinically is not matching up to what you're telling me from a textbook. And why is that? Why doesn't it match? That, when you come right down to it, is $1 million question. A drug didn't have the effect that you thought it was going to have, or it had one you didn't expect it to have. And the question is, why? And that's what a PharmD expert will do. He'll figure it out. In any event, we're going to talk about these areas with a PharmD, with the gentleman, again, known as the PharmD expert. He's Dr. Gourang Patel, based out in the Chicago area. Dr. Patel, good morning. Welcome. Nice to have you back with us. How are you today?
I'm good. Thank you, Doug. Thank you again for having me again on the program. I appreciate it, the opportunity.
Well, it's a real pleasure to have you here. And, it's funny. I have spoken to a number of people after we did that broadcast, and they were all really unfamiliar with the PharmD. They said, well, what is that? And I was explaining to them, and they were absolutely amazed. I think a PharmD is not the kind of pharmacist people would typically run into unless they were, in a hospital and a PharmD came to visit with them. Wouldn't that be right? You're not going to find a PharmD down in your neighborhood drugstore, Wouldn't that be correct?
Well, that's only partially true, actually. So the PharmD, or Doctorate of Pharmacy, is the educational degree that they built upon kind of beyond what was known prior, and many still practicing as registered pharmacist, or the initials were R, P, and H. And what they did over time is they just understood that the pharmacist's role in any setting, whether it was the community, the retail setting, especially what they kind of really observed in the hospital settings, that regardless of the size of the hospital or what kind of care they provided, that the pharmacist could provide so much more. And really it allowed them to kind of develop their practice, as we know it, as clinical pharmacy in all these areas. So I think I'd mentioned it before, but the PharmD degree now is kind of the base or foundation that you would get after finishing, pharmacy school, and then all these additional, if there's a certification or extra degrees or education on top of that. Of course, it would come after first obtaining that PharmD degree. But you will likely, at least in today's time, see those that graduated that have PharmDs at your local drugstore. The difference is really the practice of pharmacy and pharmacology.
Well, that's a great explanation, and that's good to know. We all learn, and I'm learning as well as I know many of our listeners are about what this is all about. I know PharmDs, we talked before about how you will accompany doctors making their rounds in a hospital, not exploring, but you're visiting with a patient who's in the hospital for some illness and discussing the case with the doctors and, discussing whether the medication is right and the doses are correct. That's one of the things PharmDs do. But today we're going to talk about a lot of other areas that PharmDs get involved in, and that's in the legal situation, reviewing cases not just for other doctors, but also for attorneys in a legal situation. Let's explore that a little bit and talk to me about how you get involved in a case review of that kind of situation. How do you contribute in a case review?
Sure. No, that's a great question, Doug. The case review, generally you'll have, either a plaintiff or a defendant, law firm, and then the attorney reaches out, or, maybe an associate at the firm. And what they're really looking for is they usually have sometimes very specific questions, and which is fine. It's okay. The difference is kind of digesting that question as a pharmacist and PharmD specifically, and taking it beyond. Is there additional information or that you need in order to form an opinion about whether a medication had a particular side effect, or why didn't it work as it was intended? And those kinds of questions really stem from, the PharmD reviewing the case and asking more questions, asking maybe additional materials that may have not been provided or by either side, and really kind of diving a little bit deeper, what I would say, truly past the textbook. And many of obviously can get hold of a textbook. So I think it's going kind of beyond that and looking at, current scientific literature. How do we incorporate it? Is it applicable? And obviously, as I'd mentioned prior, there are really many unknowns still in science, and especially in pharmacy and pharmacology. But there are also many known kind of principles. And so it's kind of integrating and utilizing that to come up with an opinion. And, sometimes the opinion is not favorable, obviously to the attorney you may be speaking to. But in the end, it's what the science demonstrates. And so that's what you would provide them.
What kind of case typically would involve a PharmD? I mean, would this be a medical malpractice case against a doctor, or a sudden death situation in a hospital, and someone died, and it's become a legal issue. Maybe the family is suing the hospital because something went wrong. How would your talents and your expertise be brought in on a case? Give me an example.
Sure. It could be on either kind of either end, so to speak. So on a defending end, it could be obviously defending a physician or a pharmacist and even a nurse as it relates to a medication, maybe how it was given, how it was ordered, how it was administered, what the clinical impact was after the medicine was given. And, at least on the defending side, it's whether it's defending or, on the other end being a patient advocate, the heart of the matter really is that you have to let the science kind of demonstrate itself, but it's ensuring that, it's always balanced and that you're inclusive of, with your answer of everything that you've researched and found. And so, for example, on the defending end, as one example, if a nurse administered a medication given in an IV to a patient, regardless of the setting in the hospital, and then maybe minutes later there was an effect, as opposed to other cases where there may be an effect hours or days later. And so it's really dependent, like I mentioned on the medication. Maybe it was a different formulation. Maybe it was the dose that was administered. And often, honestly, it's really kind of all the above. There's so many variables and factors you have to take into account. And so you're correct. Many of the cases I reviewed, probably the majority, involve kind of civil cases where, either it's a patient that maybe had succumbed to a side effect that was not known about a medicine. And was there anything that could have been done differently so that the patient would not have experienced that side effect? And you're correct. Unfortunately, some of those cases are, result in death. And others, it's morbidity or, additional complications, so to speak. So it does really kind of depend. There is a spectrum.
There's so many questions that arise from there. I mean, you could determine that the nurse had been correct. She had not made a mistake in the medication that, she administered. But it could reflect back on the doctor that dosage should not have been prescribed. You could have come to that decision. Wouldn't that be right?
That's correct. It could occur anywhere in the process. So, especially in a complex setting, as really any hospital really, is, even with the advancements of now electronic health records, as everyone knows, you can pull it up on your app.
Right.
Well, probably about 10 or 15 years ago, the electronic health record was just making its way into hospitals, into how these drugs and medicines were ordered. So, I think probably the public can really attest to trying to decipher or read a doctor's handwriting on a prescription they're used to take at a drugstore. Obviously nowadays a lot of this is done electronically, and that's for a very good reason. It's because there were errors in kind of deciphering, I would call it, the writing and determining you can often, end up as a pharmacist filling drug B when drug A was written for. Maybe it was a incorrect dose that was determined or written that a pharmacist was reviewing or saw. And so a lot of those kinds of errors, and there are hospitals that are still utilizing paper kind of transmission records in terms of ordering medicines. But I would say that has really dramatically streamlined the process to at least make it another safety layer for patients in the healthcare setting.
Talk to me a little bit. I mean, this sounds so fascinating. Talk to me a little bit about the additional education that you went through to achieve your level as a PharmD and all the various degrees that you have. I know you're highly educated. You graduated magna cum laude from the St. Louis College of Pharmacy, but then you went on to get a Master's of Science in Clinical Research in graduate school. Is this pretty typical for PharmDs to continue their education? I mean, how many years did you go through school before you actually came out and went to work? How many years altogether?
I would say in total it was about approximately would have been 10 years. If I add on, wow, graduate schooling, that was an additional 2 years. However, I was able to do it, obviously part-time while I was still working. So, I guess 12 years all in all. But, it really goes to the what a pharmacist or a PharmD would like to pursue. And I always, I think in reflecting on, at least my career thus far in the last 20 years or so, it's really been about learning. And, you can learn as much from a physician, a nurse, another pharmacist. You could learn something from them, even when they've just graduated. So, it's the mindset of, I guess I call it, you're never done. And that's kind of true. You're not really done learning, so to speak, until you retire. But I guess that's just my opinion. And that is because it leaves you more open-minded to how, science is changing and evolving and what we do know about medications and, health conditions and disease states. And there is so much more we still don't know and have not been able to figure out. And so it is kind of ever evolving. And I believe it allows you to stay a little bit more humble. And, it demonstrates and exercises some humility that, you could learn as much or something from a medical student, probably no different than someone like myself practicing 20 years, after graduating. So there is kind of a spectrum, of course, but that's really the heart of it, is that you have to be open to other theories and other perspectives, and then, of course, make the best decision you can for the patient.
It's so interesting. I'm wondering, is what you're doing now what you anticipated you would be doing when you went to pharmacology, entered the field of pharmacology as a student? Did you imagine you'd be doing these kind of things?
No, that's a great question, Doug. I did not. Going through pharmacy school, I worked at a local, in St. Louis, a local Walgreens, and Fridays or Saturdays or Sundays generally, and it would be, of course, after classes got done or on holidays or weekends as additional time allowed. But, that's what I thought I was going to do the rest of my life. And it was patient contact, so you got to meet patients and speak with them. You got to see the challenges of the healthcare system, at least here in the States, about how patients can be able to get their medication, and on some and many cannot. So they just don't have the access to health care. And that's what I thought I was going to be doing the rest of my life. And then through pharmacy school, that last year or so, we have rotations that kind of take you through different hospitals and healthcare settings. And one of them was retail, and the other, 5 or 6 I selected were all hospitals. And I did that intentionally because I had worked as a pharmacy technician as a student already for 3-4 years, and I had a pretty good sense of what that was about, but I didn't really know what pharmacists did or had the ability to do in a hospital. And it really opened up my eyes. And you got to work collaboratively with the healthcare team and really kind of help change practice and move it to a platform that's, just as, improving the efficacy and safety of care.
Well, I really think what you're doing sounds absolutely fascinating. And at one point you said what you're doing now, the pharmacist has been liberated from the box, as you put it. What do you mean by that? I know you have experiences now in the operating room, to the courtroom. It's really quite broad. It calls on a lot of your talents, doesn't it? It's kind of amazing and interesting.
Yeah, it does make you really kind of open up your mind to think of. It's going back to, I think I mentioned, going beyond the transactional role. So even in the operating room pharmacy, which is a really good example, I would say probably more so in especially the last 5 to probably 10 years, believe it or not, has it really started to exponentially accelerate in pharmacists going beyond what I'd call, and what it was and what it still is sometimes a box. And you're in there dispensing medications for patient care. But, at that time, I could confidently say, 10 years ago, once that medicine or medication left the operating room pharmacy, you didn't know what dose they were giving. You didn't know what they were even probably using it for. You didn't know if there was a safer drug that maybe you could have helped guide the clinician or practitioner to, and it just wasn't a role defined. And honestly, I don't know if the healthcare field at the time was ready for it. But then, as soon as pharmacists, many no different than myself, across the country, there's so many doing great things in this field in the operating room, what we would call the perioperative space, far more than what I've accomplished, honestly. And they've really kind of helped develop the presence and being in the operating room itself and working with the operating room nurses, anesthesiologists, and surgeons, and how can we help make care more effective for your outcomes? How can we make it a safer environment? And I think that's really kind of the testament.
And do you feel that there have been instances, and I'm sure there have many instances, where your presence in the ICU or in the operating room, observing what was being administered drug-wise and what was taking place during the surgery, has really contributed to the success of the treatment of the patient? Would you say that's true?
It's my opinion. That is very true. But honestly, there are thousands of pharmacists across the country, at least here stateside, and even globally, that have demonstrated that through contributions back to the scientific community, and many, way more than I have, honestly, in my career. And they've done an excellent job. And in doing so is one of the reasons I pursued research. And that is kind of a testament, again, to contributing back to the scientific community, what I would call lessons learned, right? So you observe something, and you notice this actually in any field beyond healthcare. But, if you were to pull up a journal of any discipline, likely many of the articles in there, by happenstance, are positive ones about, something somebody studied or researched. And, over time in the healthcare community, we became very, open to publishing when we didn't have a great outcome or something we researched. And that's so others can learn and don't make the same mistake or the intervention that maybe we did. And so I think that's really opening up people's minds to, what research and science is really all about. So, I think it's made a tremendous difference. But, as I'd mentioned, and you touched on it right in the beginning, the area of what I would call forensic pharmacology or pharmacy is really kind of advanced and allowed us into an area, whether it's a courtroom or, trial testimony or via deposition, to really explain the kind of pieces and variables in pharmacy and in pharmacology that can impact an outcome.
I was just saying that's a whole different ballgame for what a typical pharmacist would be expected to do, to go in and testify in a court case. That might be rather nerve-wracking for them. I would think. Would that be right? Do you have to be kind of prepared for that in a different way?
Yes, it's a much different field in the sense of, you have to be prepared in any setting, honestly, for criticism and what they would call rebuttal. And being in the healthcare field, honestly, I don't see it any different. I present a recommendation or a suggestion to change therapy, maybe, and obviously providing rationale on why. And if you really think about it, how different really is that than the courtroom, right? So, you're providing an opinion. It's based on what you have found and researched, and you're correct. It's much different than giving a presentation to, to medical students or nursing students in an auditorium. And you kind of take that, and now you're in a courtroom, and all the eyes are kind of focused on you, and people, obviously attorneys especially, are listening to your every word. And so yes, it is a much different. It's not, I would say the same at all by any means, but there are some principles that are similar or the same, I would say.
And I was just saying, you're saying attorneys are listening to your every word. Also, there are times where attorneys would challenge what you're saying, would question you. Wouldn't that be right?
I would say that would probably be, at least if they're on the other side. That's a pun. I wouldn't say there's many things in life 100% guaranteed. I would say that is 100% guaranteed.
Yeah, well, that's a whole different thing. You are known as the PharmD expert. You have a great website, by the way, and let me give this out. If anybody wants to find out more information about Dr. Patel and how to get in touch with him, his website is simply PharmD Expert, PharmD Expert.com. If you go there, you will learn all about the doctor, what he does, what he has done, and what he's doing now. I assume you do this because you're known as an expert, and I guess medical professionals as well as legal, the legal members of the legal profession contact you. You're in the Chicago area, but they may contact you from California, Florida, wherever, to come assist in a case. Would that be the case? Is that right?
That's correct. I probably, I believe I probably, the scope of my review and practice, at least in this sense, in this field, in forensic pharmacy and pharmacology, is probably spread now. I've probably at least over half the states in the U.S., so I would say it's pretty broad. That's correct. And in most of it, if not all, is referral. Obviously no different than in the healthcare field. Attorneys do communicate, obviously, and talk with their colleagues. And so that's how I guess they would contact you and how you would become known.
And is this primarily what you're doing at this point in your career, or are you still on staff at a hospital, visiting the ICU and the operating room on a regular basis?
No, I'm still actually 100% in the hospital. The consulting practice and work, I would say, is limited to evenings and obviously, likely weekends, as the time is needed or required for a particular matter or reviewing a case. So it is a little bit more flexible in that sense. But no, I'm still a full-time 100% at the hospital at the University of Chicago Medicine, which is located obviously here in Illinois and Chicago.
In Chicago. Well, Dr. Patel, we've run through the half hour again. You're fascinating to talk to, and really it's great listening to what you do and how the field of a pharmacist has really expanded. This has been amazing. Thank you so much for talking with us and taking the time out of your schedule. And again, if anybody would like more information or to get in touch with you, go to that website. It's PharmDExpert.com. Dr. Patel, have a great day. It's been great having you with us again. Thank you for coming. Okay?
No problem. Thank you, Doug. Thank you again for the opportunity.
You're very, very welcome. That's it, everybody. Thanks for joining us. This has been great.
You have been listening to a broadcast from Close Up Radio, a division of Close Up Television Incorporated. For more information about our show and to be considered for future broadcasts, please visit closeuptelevision.com. You may also learn about us on social media and listen to us on podcast and internet radio. Thank you for joining us, and we hope that you have an empowered and productive day.